Ada anikas program marhaba danna de mi program galgum hama wara bævara malumat ekken eki tantanun de hedmet ek wa kasipat ekke
den hasa ko den awulmenge mi tiriulu ragalo halet ek gendum ge wahakat ke bodan awulmen me dakkane awulmenge dule hosi hat ek tibuma awulmen ufaveri hayat ek heda kurmata ka awulmen kurwen kan kami fa tafat wahakat ke me dakkane en soba den soba e gotam mi wahakat dakkala ero awulmen by fahar eba hure me waki kahala kantat take ga waki gotta kan awulmen danje kan misa ka waki kahala bayyeg ge vejjama awulmen e doctor ka dakka gen skuri danga bejen huniyam family ga waki kahala kantat take hunna kam gawanama family en hasa doctor on take ebati benje enno medene e bay ko hasa kuravigen kuri da kam
bay kahal de mi kahala terms ki family medicine ne ehem bona hi samsafatan mi coach bay neengi dana waragena be tibbawane en ki den mi ingegen adi ingene mi kiwegen kam me muhimone
sen ehem mi maulumat hodanum ke waram muhim kam
waram muhim kam den midum program ki tibe ferna me family ke den treat of hospital like the treat of hospital woni wade nege eful kono nane rajye gen den inge tibe ferna hidmete ka be gote malumat gen smete ka program ga tibe ferka bare lava with us today we have Dr. Manar Karam family medicine specialist, right? And then Vimal Rapheal, chief of rehabilitation therapist. Welcome both of you. How are you?
Good.
Yeah, we were just saying that even though we mentioned family medicine, some of us might not be familiar with the term, right? Yeah. Can you please explain what family medicine is?
Actually, family medicine is a broad scope term. It deals with the person as a whole for treating the whole condition that might affect any person. Not only the person, but also the families. So it's not only focused on providing treatment of the common conditions, but also preventive care and primary care that can be sought by anyone. So likely if you're an adult, you can seek a consultation with an internist or a family physician. If you're seeking primary care for your children, also you can see a family physician or a pediatrician. But if you're keen on developing like a long-standing relationship with your physician, the family medicine would be the best option for you.
Gama samayerong e doctor ka libin dan fursat taking e family ge midane e kantat take belum ga hasa kong history mi huri ha kan take dene ga tum fursat tengen
also you provide a lot of care, right? I mean what kind of care do family physicians provide? I mean there are certain things that you will be looking into. For example, he just mentioned that you'll be checking the history of family and what are the problems that we might have carried, right?
See, the family medicine is the first step that any patient can come to as a start for seeking help. Okay, so family medicine basically can treat like 90% of the most common conditions that we may encounter in our clinical practice. So it's not only for treating the conditions, but we do also provide screening tests, health care packages, health risk assessments, the routine annual checkups, the vaccinations, health education. So it's mainly focused on the primary preventive care rather than the secondary or the tertiary care of the common conditions even.
So, me alave sama then kuriga kuring family care doctor hasa kura fane kam ga venamis we fursat taken hen gos me har sorang awmen ngam hasa kura vedan gos waki kahala me fa kura ko ta baki kahal belun take balalen ham huri ha test take vese bor he and Dr. Rapheal, what are the rehab services available at Treatop?
So in Treatop Rehab Center, we have all the types of treatments which are designed by our expert therapists, qualified therapists. So the main services that we focus is physiotherapy, occupational therapy and speech therapy. So once a person falls ill or after any injuries, so our team is more dedicated to improving, maintaining or like restoring the physical health, the cognition and mobility. And some other areas that we are focusing is post-operative rehabilitation, orthopedic and sports injury management, cardiac rehabilitation, pediatric rehabilitation, neuro rehab, and we are doing also the ergonomics training.
Okay. We were just discussing about finding out the history of the families, right? Family members, then you will know the common problems that we have as well, right? So what do you think? What are the primary care physicians is right for you? How do you decide that?
See, since this is the family physician should be the first person to be seeing the patient, so the family physician takes a very good full history of the patient condition, the family history, the drug allergies, everything.
So you first check it, right?
Yeah, of course. We have like a baseline document for every patient. And according to the complaint of the patient, we deal with the condition. If he needs any further investigations or any further care by other specialty, we do refer, of course. And doing the checkup investigations, even for the healthy individuals, make us like find the common chronic health condition that may affect any person at any age group, even like anemia, diabetes, hypertension, hypercholesterolemia, the common endocrinal problems like the hypothyroidism. And especially here in Maldives, we have like a variety of conditions that are very common
within
among
the family
families,
well,
within
right?
the family, like thalassemia, for example, and other stuff. So the primary physician or the family physician takes full history of this and predicts if the person or even the children are at risk of developing health conditions further on in life. So that's the main scope, to prevent rather than treat. Yeah.
So what are the common conditions that you treat?
Like most of the common conditions that we encounter even in the ER are green zone patients that can be seen in the general consultation in the family clinic, like upper respiratory tract infections, chronic conditions, as I mentioned, like diabetes, hypertension, hypercholesterolemia, the common skin conditions, common eye infections, common ear infections, back pain, we do see it a lot, and of course Vimal is so familiar with this, and muscle sprains, like minor traumas also, some types of allergies and some burns and sex bites. Those are the common forms of allergies that we see, and like many others, the conditions that can be seen by different other specialities as well.
Okay, so it's really important, I believe, to check regularly, right? Which is something we hardly do. We really take it very lightly. I think we take our health for granted, isn't it?
Yeah, we do care only when we feel pain.
Yeah,
like we
or
have a
else we don't.
condition.
We need to go with our children, have a checkup once in a while, right?
Of course, that's.
So I think me Dr. Rapheal fahakuri ko treat upon war gina hidmat tekin veli hen tafat ki hidmat telli beeruga hitanga rahma harang Dr. Rapheal, what are the common conditions that request rehab?
So the common conditions is, of course, the neck and back pain. We get a lot of referrals from the doctors.
I was just telling him I have neck pain today.
All of us.
Yeah, like
We always
that's
tell
it. Mostly the youngsters are affected because the primary cause is the posture. Okay, the awkward posture is giving a high amount of strain over our primary joints, especially our spine. So, see, in the modern technology, we all are familiar with these cutting-edge technologies like mobile, laptops, computers. So we all use that. It's like an essential part in our
So the
life.
way we sit is...
Yes. So we never think about how we are sitting, how much time we are sitting in front of like a wrong posture. We don't bother about that. We are busy persons. So what happens is this prolonged, the posture is leading to some conditions. Once we get the pain, then we realize, then we go for the doctors. So my suggestion is like a proper healthy life. When I tell about healthy life, everyone is thinking about their diet. No, but exercise is also important thing. So getting a good stretching and strengthening program from our experts can prevent from some of the conditions. So my recommendation is like ergonomics training. So the word ergonomics means like it's a science that shapes the job or equipments more worker friendly. Okay, so most of the people are asking why ergonomics. So I told them, you guys are busy. So you don't have time to do the exercise. So at least you can do the exercise while you are in the office. So our experts will teach very simple exercises, ergonomic exercises that can be done in the office, when you are in the office or at home. Just takes only 2 to 3 minutes. So it is like best, and it's proven like.
Yeah, Doctor, now we have smart watches or mobile phones that reminds us like every 5 minutes that you need to get up, because it does to us, right?
And Dr.
But do you?
Do we?
So then Dr. Fakuri gotang government nang hama gina fahara kame dimawi mo Dr. hama mi deveni ege kuriyan government samalu kon denga je e vidalu gota government tibe
phone hisagen inneni apata mihen
deve gota kun nuni
kala so coming as me complaint korani da bahaw kare
එහෙම මේ අවුල්මෙන් අස්සේ එකමගේ වජේ සමාල මන් දැන් යන අවුල්මෙන් තදෙන් අරාගෙන ડોක්ටර් දියුම්ගේ කුරියන් අවුල්මෙන් ගේ ඉඳ වෙනි කිහින තෝ පෝස්චා ඉඳි කිහින තෝ මිසක මේ ඔෂෝ වෙගෙන් ඔන්න ගොතකුම් කර තදෙන් අරාපන එහෙම ඒ රංගල ගොත්ත හේක බෑකන් ගොත්තම් හොදම් වෙසෙබෙන් ට්‍රීට් ඔප් ගොස් අවුල්මෙන් කන්සල්ට් කොල්ලිම ડોක්ටර් විදාලේ දෙවන්නේ කො බෑකන් මේ කුරම් විකාන්ත තන් හාසකො कुछ कुछ कष्ट था देम डॉक्टर पाकुरे बता ऑफिस होगा माँ हाउल को मिकुरा बहन खाते थे बस हम ट्रीट अप गए डॉक्टर विदा
अब देशिन तक
नीना शे एन कष्ट कोराशे में हाँ सको डॉक्टर का हमें दियों के कोरिया में रंगल से खाते गहुना मसे कोरा
so family medicine family care is a quite new term for us. I think for most of us, right? So the fact that you have a family clinic is a wonderful thing actually, right? So can you please tell us what kind of services you provide in Trade-off Hospital?
Usually the family clinic was not established as the term of family clinic. So we were used to providing health screening packages, pre-employment examinations and vaccinations. But now when we established the family clinic since last December, we starting providing general OPD consultations for all the people who are seeking medical help for all ages, for all genders. Plus, we are providing also routine checkups, routine annual investigations, health risk assessments, and personalized counseling on maintaining a healthy lifestyle. And also now we're working on implementing new health screening packages and health education campaigns. Yes, yes. For families and for chronic patients, and also health education campaigns.
Maneki ayla ekko gosama check kolle vene hen
na मैं और मैं एरस फाक कोई बताएंगे आईलाइन हम अभी वाकी को तक मैं बटन को गन डॉक्टर खास को फिर कम को ना फंसे है कि ना हिस्ट्री तक आए नहीं सोफा ट्रीट ऑफ पे मुनीमा आमुंग हम हित को फिर सवाल तक होना है हास को ट्रीट ऑफ पे मुनीमा राज्य के देंगे हेंग हॉस्पिटल तक बरें हाई लेवल तक विस्ना ट्रीट ऑफ उन्हें बेहिद में तब बेचना गलवाने फैसिलिटी तब बेचना गलवाने
up to date one
what are the facilities and the latest services available at Trade Off?
So in rehab we are having a group of therapists who are well educated and experienced in the latest manual therapy techniques. So we can talk about the soft tissue releases or the dry cupping, functional dry cupping, the trigger point release, myofascial release, and some are specialized in dry needling technique also. So for the pain management, what we are using, the latest electrotherapy modalities or the equipments that like shockwave therapy, laser therapy. So we are using those things to reduce the pain along with the exercise. So when a patient or the guest comes to our department, he is getting nearly 45 to 1 hour of treatment with all the facilities, latest facilities plus exercises. And we in Trade-off we have a special room that is designed for sensory integration and behavioral therapy, which is more taken care by the occupational therapist, and they take care of neurological conditions too. And like speech therapy, we are having the best experts, and they do the audiology test. We have a
You have doctors now, right?
Yes, yes, and the audiology labs that we are having is with the latest machines, and we do the tests, and also we have the dispensing of hearing aid with the latest technologies.
It sounds very promising, right?
Of course.
Yes. I think this is a reminder for both of us as well that we need to go to you with our families, do a checkup and get proper treatment for what we have, right?
So faham adeng faakuri ko tanga Trade Off ge ad em latest hid में तली में मुरे रुगा आशा को दे में डॉक्टर फाक को फिर hearing aid को मस्से तब हम फतु आडू में मस्से तब हुन्ना कम गोवाना
नहीं वाह के
देखो बस मस्से तब हुन्ना कम गोवाना एक हम बस पारो है मेरे बेदeng कोरिंग हमारे में नवी दिमाग में कम राज्य का यह फसे हेन्नो मिकंत तक आशा को पारो हो जाके हेन्नो Trade Off आए कि गा मिहार में नहीं हम हेन लेवल का
by far deng ami speech therapy hodam benam wes by befla hama diriulung muling hen gama kam badal ko and like in the recent years, like if we needed a speech therapist for our child, then we just move abroad. So that was our solution back then.
That's
but
why
now,
we are seeing the vision to be the best healthcare provider in Maldives.
Yes, if we can get everything while we stay here at home with our families, then that's a wonderful thing, right? Thank you both so much for joining us today, and I really hope that you're saying that we have specialists, you have doctors, you have all the services, so come to you.
Yes.
We will try to go.
Sure.
Always
Most welcome.
Thank you so much.
Thank you.
Thank you.